Welcome to today's webcast from the Agency for Healthcare Research and Quality on the SOPS Nursing Home Survey version 2.0, Updates, Insights, and Implementation. My name is Joann Sorra. I'm the director for the contract that supports AHRQ surveys on patient safety culture, or SOPS surveys, and I'll be the moderator today. Next slide. Let's begin with some technical information. First, if you're having any issues with sound coming from your computer audio, you can connect using your phone by selecting the Call Me option to enter your phone number and receive a call from Teams, or you can use the dial-in number and meeting ID. If your computer freezes at any point, it may just be a lag in your internet connection, or you can try logging out and logging back in. At any point in today's webcast, you may ask a question through the Q&A icon. Once you type your question, click on the Ask button to submit it. We encourage you to share your name or organization or role when you type your question. Speakers will respond to your questions during the Q&A portion at the end of the session. Please note that the raise hand feature and chat are disabled, and attendees are muted and cannot show video. You can download the presentation slides on our event website at https://events.westat.com/SOPS. In today's meeting, some polling questions will pop up on your screen, and you can respond and click Submit. We will show the polling results in real time as everyone responds to the poll. Next slide, please. Now I'm happy to introduce our speakers for today's webcast. We're very pleased to welcome Bill Martyak, who is the Chief Clinical Officer for AMI, and Jamie Thomas, who is the Senior Quality Improvement Manager at AMI. We also have Jonathan Bakdash, who is a Social Science Analyst for the Surveys on Patient Safety Culture program at AHRQ, and Naomi Yount, who is a Principal Research Associate at Westat and Instrument Development Lead for the Surveys on Patient Safety Culture. And again, I'm Joann Sorra, and I'll be moderating today's webcast. Next slide. Our agenda today starts with John Bakdash, who will give a brief overview of the AHRQ SOPS program. Naomi Yount will then review the development process behind the new Nursing Home 2.0 survey and review results from the new survey items. Bill Martyak and Jamie Thomas will then discuss their perspectives on administering the survey within AMI, challenges they encountered and how they were addressed, and they'll discuss how they use the survey results for action planning. Finally, we'll end with questions and answers. So let's begin, and I'll hand it off to John. John?
Thank you so much, Joann. Hi, I'm Jonathan Bakdash. I work for the Agency for Healthcare Research and Quality, AHRQ, and I'm going to give you a brief overview on AHRQ and the SOPS program, the Surveys on Patient Safety Culture program. And please feel free to contact me if you have any questions about the SOPS program or any other programs at AHRQ. My email is jonathan.bakdash@ahrq.hhs.gov, jonathan.bakdash@ahrq.hhs.gov. Next slide, please. So a bit of background about AHRQ. AHRQ is a research-based agency that's part of the U.S. Department of Health and Human Services, and we support evidence-based practices. We're the lead federal agency responsible for improving the safety and quality of the U.S. healthcare system. What we're not is we're not a regulatory agency. We don't require the use of any of our tools or products or instruments. We recommend that you use them, and we encourage their use. We encourage you to submit data to us, but we don't actually require it. If there are requirements to use a particular AHRQ tool or survey, that comes from another agency and not from AHRQ. Next slide, please. So stepping back, what is patient safety culture? I like Brian Sexton's definition of how we do things around here. If something goes wrong, do you look for who to blame, or you try to figure out how are we going to learn from this to prevent it from happening next time? I think that's the most succinct definition. So a more detailed definition would be the beliefs, values, and norms that are shared by healthcare staff. So kind of what behaviors are rewarded, supported, expected, and accepted. And this exists at all levels, from frontline workers all the way to the executives. Like, are there open lines of communication? Can people speak up when they see something not going well? And is there really learning from what happens? So the same things do not happen again, and preventing errors and improving safety. Next slide, please. I'm going to give you a brief overview of the core areas of patient safety culture that are assessed in SOPS surveys. This is across different settings for SOPS surveys. Just for example, communication about error, communication openness, which I talked about, handoffs and information exchange. So those are some of the core areas that are generally assessed by different SOPS surveys. Next slide, please. As I mentioned earlier, it's voluntary whether or not you submit your data to AHRQ, and we maintain confidentiality. So that limits the use and access to data for only what you sign in the data use agreement. It's very similar to a certificate of confidentiality in research. And we just want you to know that your data is protected when you submit it, and that it only de-identified data is shared in aggregate. And one advantage of submitting, also emphasizes, is you receive a private feedback report, so you can see our areas of strength, and you can also see areas for potential improvement. And that's one of the benefits of submitting your data. Next slide, please. I'm going to plug some related programs that also could help improve patient safety and patient safety culture. Another program at AHRQ is Team Steps, which is team strategies and tools to enhance performance and patient safety. And they provide a variety of training curriculum, including for diagnostic information, how to communicate better. And this is really about optimizing and improving team performance. Another program at AHRQ, which is kind of the opposite side for the SOPS surveys, is the Consumer Assessment of Healthcare Providers and Systems program, the CAPS program. And the SOPS program assesses safety culture for healthcare providers and other staff. The CAPS program is the other side of the coin, which is what happens to patients during healthcare. So that's assessing the other aspect, another aspect there. And last is the Patient Safety Organization program. And this is data that gets collected and voluntarily submitted to improve patient safety and quality. And nursing homes can also work with patient safety organizations, and that data is also protected in various ways. There are common reporting formats so you can compare and again learn from things that happen and prevent mistakes or incidents from happening again in the future through learning. And now I'm going to hand it off to Naomi Yount, who's going to give an overview of the Nursing Home SOPS 2.0 survey. Thank you.
Thanks, John. All right, let's jump right in about the Nursing Home version 2.0. Next slide, please. All right, so a little background, the Nursing Home version 1.0 was released in 2008. And so over the years, AHRQ received feedback from users about suggested changes. And so the goals of creating version 2.0 were to address some of those suggestions. And they would remove negatively worded items, reduce the length of the survey, reword some items that were either outdated or unclear, and add new content areas related to resident safety. There was also a request to revise some of the staff positions or work areas to be a little more granular. Next slide, please. The development process follows the standard SOPS development process, which includes conducting a literature review, looking for new and updated patient safety issues, convening a technical expert panel, or TEP, and we got their input throughout this entire process, although they're only shown once here on this slide. We also interviewed nursing home experts, frontline staff, and because there was a 1.0 version, we also talked to users of the nursing home survey to see what are the key areas that we wanted to retain and what did we want to change for the survey. From there, we drafted survey items and cognitively tested them with nursing home staff, and we iteratively revised them and then tested them again to ensure that they were being understood as intended. In the fall of 2024, we conducted a pilot test, and there we did psychometric analyses, which is really just looking at, is the survey reliable and valid? We then finalized and released the survey, and this survey was released in April of this year. Next slide, please. So we did get to our goal with the 2.0 survey is shorter. The 1.0 survey is 51 items, and the 2.0 survey is just 30 items. There were some changes. Only 9 items from 1.0 remain the same with no changes. 7 items had minor changes and 3 items had major changes. A lot of items were dropped and 3 items were added to 2.0. Next slide, please. As I mentioned, a lot of items were dropped. 10 of those items came from 4 composite measures. Communication openness and overall perceptions of resident safety were dropped completely. Compliance with procedures and training and skills, we dropped all but 1 item from each measure. So they became single item measures. Next slide, please. Okay, so we conducted the pilot test, as I mentioned, in fall of last year with 27 nursing homes. We had an average of 44% response rate, 50 respondents on average per nursing home, although that did range from 13 to 119 respondents. We did see that the response rates were higher for nursing homes who opted to do the survey via paper. So they had a 66% response rates versus those nursing homes that wanted to do it via web at 42%. Just an interesting thing to note, we did do the pilot test with the nursing home 2.0 survey, and we added the nursing home workplace safety supplemental items to this. Those items were developed and tested and released in January 2023, but we went ahead and added them to this so we could collect more data and update our results. And at the end of my talk, I'll say where to find those. All right, next slide, please. We had the respondents were about 33% were nursing assistants, that's certified nursing assistants, geriatric nursing assistants. Just 9% worked in a short-term care or rehab unit. The rest were working in long-term care, memory care, or didn't specify unit. They worked across units. 21% worked in the nursing home for 3 to 5 years, and most of them worked the day shift. Next slide, please. I'm going to share results that are percent positive scores. A percent positive score is just those respondents that selected one of the 2 most positive response options. So in this example, for the question, staff feel like they are part of a team, it is the percentage of respondents who selected agree or strongly agree within that nursing home. Next slide, please. So we calculated percent positive scores for each nursing home, and then we averaged them across all the participating nursing homes to get the scores you're seeing on the slide, the average percent positive score. The composite measures here are sorted by highest or most positive to least positive. So we see here that speaking up is at 86% positive, and then staffing is the lowest positive, which is at 54%. So what I'm going to do now is walk through each of these measures, share with you the items, and share open-ended comments that were shared on these. Next slide, please. Okay, for speaking up, this was our most positive composite measure, had 2 items. Staff speak up if they see something that might harm a resident. That was 91% positive. And then staff feel comfortable asking questions when something doesn't seem right at 80% positive. Next slide. While this was the most positive measure, there were only 2 comments, open-ended comments, that were related to this, and they were both pretty negative. Healthcare workers are not encouraged to speak up, and people do not feel safe to speak up. Questions never get answered. Next slide. Organizational learning also had 2 items. This nursing home makes changes to prevent the same incidents from happening again, at 86% positive, and this nursing home actively looks for ways to improve patient or resident safety at 83% positive. Next slide. Some sample comments for this measure include, this facility has made some strong changes. They're creative in trying to manage these situations, and our facility makes an enormous effort to identify process problems. Next slide. Supervisor support for resident safety had 3 items ranging from 77% positive to 87% positive. These items look at whether the supervisor pays attention to resident safety in the nursing home, whether they listen to staff ideas and suggestions, and whether they provide positive feedback when staff have done a good job. Next slide. Sample comments for this measure are our floor has gone days without seeing a supervisor. Staff are disregarded when expressing concerns. And supervising staff goes above and beyond to aid with residents and even patient care daily. So we see a positive and negative comment for this one. Next slide, please. Our next measure is handoffs and information exchange with 3 items. They're all in about the 70s, in the 70% positive, 71 to 79% positive. They ask, our resident needs are met during shift changes? Are staff given all the information they need to care for residents? And are staff informed when there is a change in the resident's care plan? Next slide, please. The 2 measures here show staff are not provided with basic information routinely for resident appropriate care, and lots of vital information is not being given to the CNAs at each shift change. Next slide, please. Management support for resident safety has 3 items. 2 of them are 77% positive. Management encourages staff to suggest ways to improve resident safety, and then they take action to address staff concerns about resident safety. And then a little bit lower is 67% positive. Management walks around the nursing home to check on resident safety. Next slide. 2 sample comments here is I do not feel the upper management is willing to listen or do anything with my concerns. And upper management sends a message that money comes before all resident, staff and resident needs and safety. Next slide. Our next measure is response to mistakes. There's 3 items ranging from 69% positive to 73% positive. At 73% positive, staff are supported when they are involved in a resident safety incident, followed by staff feel safe reporting mistakes, and staff are treated fairly when they make mistakes. Next slide. Some sample quotes here. We have been belittled and told mistakes are our fault. And as far as support when mistakes are made or there are incidents, some supervisors are more easily approachable than others. Next slide, please. All right, teamwork has 3 items. They're all at 70% positive. Staff treat each other with respect. They feel that they're part of a team. And when a staff member gets really busy in this nursing home, others help out. Next slide. Some sample comments here is this is a great team that works together well versus all shifts complain about every other shift. There is no teamwork. Next slide, please. All right, this is our least positive composite measure of staffing. There are 2 items here, and they are pretty low. At 59% positive, staff have enough time to meet resident needs. And at 48% positive, we have enough staff to handle the workload. Next slide. Sample comments probably won't come as a surprise given these scores. The staff are tired and overworked. We need more staff. I do not feel it is safe to work with the staffing ratios that we are currently required to follow. Next slide, please. There are 2 single item measures. Staff follow the nursing home's policies and procedures to care for residents. That was one of those items that was kept from compliance with procedures. It's at 83% positive. And then we kept that 1 training item. Staff get the training they need in this nursing home, and it was at 74% positive. Next slide, please. Some sample comments here is we have to remind staff that they can't be on their phones unless they are on break, and more hands-on education would help. Next slide, please. We also include a willingness to recommend an overall rating of resident safety. And 81% of respondents said yes, they would recommend the nursing home as a place that provides safe resident care. And interestingly, just 65% rated their nursing home as excellent or very good on their overall rating on resident safety. We did a little digging on this and found that if you included excellent, very good, and good, it was around almost 90%. And so that's a little closer. So maybe people are more willing to recommend as long as it's a good, they rate it good overall. Next slide, please. Some sample comments here is I would not recommend anyone here for residing because of the unsafe staffing ratios. And resident safety is always the #1 here. We only want the residents to feel like they have a safe place to live. Next slide, please. All right, those are the results. We also, as I mentioned, did psychometric analyses, which really looked at the validity and reliability of the measures. I won't get too technical here, but we looked at internal consistency reliability, which indicates how consistently respondents are answering the items within each measure. And we found that all of the measures had acceptable reliability, which is above 0.7. We also conducted confirmatory factor analysis, looking at how the items hung together and to assess the validity of the measures. And all the results from the factor analysis were acceptable as well. We looked at the factor loadings and goodness of fit indices. And then we also looked at the correlations between the composite measures, single items, and ratings. And they were all statistically significant, but not incredibly high. So they were the low to medium, which showed that they were assessing unique yet related aspects of patient safety culture. So in summary, we found the survey measures were reliable and valid. Next slide, please. All right, so where can you find all this information? We have a lot of materials on the AHRQ website. We have the survey available in both English and Spanish. We have a crosswalk that shows you item by item the difference between the 1.0 and 2.0 versions. So you can see the items that remain the same, which ones are minor wording changes, major wording changes are the new items. We also have a survey user's guide, which provides detailed information on how to get started with the survey, such as how to administer the survey, whether you want to do paper or web, and analyze the data. There's also additional resources, such as the data entry and analysis tool. And this is an Excel tool where you can either hand enter your results, your data, or copy and paste values into the data entry sheets. And the tool automatically calculates your results and displays them in tables and graphs. And it compares to the latest database. In this case, it would be the pilot test results. The tool can also be used to export your data to submit to the SOPS databases. So this is the only resource that's not actually physically available on the AHRQ website, but I'll share how you can contact us to ask for that tool. There's also a SOPS action planning tool, which is great. After you've analyzed your results, you can use it to figure out what to focus on to improve culture in your organization. And then there's improving patient safety resource lists. So we have this available for every survey and every setting. So we have one for the SOPS Nursing Home 2.0 survey and a separate one for the workplace safety supplemental items. And they share practical resources that are free, publicly available, that help to improve safety culture. And what's nice is, based on your action planning, you might decide you want to increase and try to increase your scores on organizational learning, for example. You can go to those lists and they're sorted by composite measure, and you can go right there to see how can I improve on organizational learning. On the nursing home database page, we have the 2.0 pilot test results. So I just went over those results, but there is an appendix to the report which shares breakouts by respondent characteristics. So if you really want to compare, like, oh, I want to see how the CNAs are doing versus management, you can go there and it shows you those results, among others. There's also updated nursing home workplace safety supplemental item results. So we have that. That's based on 72 nursing homes. I encourage you to go and take a look at those. All of these, except for the data entry and analysis tool, are available on the AHRQ website, which is www.ahrq.gov/SOPS. Next slide, please. All right, so if you want that data entry and analysis tool, or you want to reach out and ask us some questions, we have two ways of getting in touch with us. We offer free technical assistance, or TA. Our general TA help desk can be reached at 1-888-324-9749, or you can email us at safetyculturesurveys@westat.com. And this mailbox, they can help you with questions about survey administration. They can connect you with any of our survey materials or supporting resources. And international users can also request permission to use the SOPS surveys in their respective countries. There's also a database TA help desk, which is 1-888-324-9790, or databases on safety culture at westat.com. And they can assist you with submitting to the various SOPS databases. They can send you that data entry and analysis tool and answer questions that you might have on how to do analyses or where to find something in the database reports. If you aren't sure which one to email or call, you can call. We'll get in touch. We'll put you in touch with the right people, so don't be too worried about which one to pick. And again, all of this is available on the AHRQ website at www.ahrq.gov/SOPS. All right, I've done a lot of talking, and now we want to hear from you. There's going to be a pop-up window with the question that's on this slide. We ask that you go ahead and answer this. If you are using a Mac, you may not have this option, so I apologize. But if you do, go ahead and respond. I'll read the question. What do you believe is or could be the most valuable benefit to administering the AHRQ SOPS Nursing Home 2.0 survey in your facility? Please select just one you think that's the most valuable. And if you are not in a nursing home setting, go ahead and set not applicable, or you have no way of administering the survey, you can hit that not applicable response. So I'll give it a moment. We're having live results come in. Right now, it's looking like the winner is identifying areas of strength and opportunities of improvement in patient safety culture. And I think that's great. It is a key benefit. We can go ahead and close the poll. I'll just say that administering the survey and looking at those identifying areas of strength and opportunities for improvement is a great first step, but don't forget to share that feedback with your staff and develop an action plan and do something with those results to make improvements. All right, thank you very much. I'm going to turn it over to Bill Martyak. Thank you.
Thank you, Naomi. It's great to be here. My colleague Jamie Thomas and I are truly pleased and honored to join this webcast today. Next slide, please. So we will provide some information from the user perspective. We'll cover the following focus areas today, as you will see on the agenda slide. We'll provide an overview of the background on AMI Expeditionary Healthcare and the Pennsylvania Department of Health Long-Term Care RISE program. We will also cover how the AMI LTC RISE team administered the survey. We will cover challenges and lessons learned, and we will review how we were able to draw on the results for action planning. And finally, we will go over our next steps and our resources. Next slide, please. So I'll provide a little bit of information and begin by providing an overview of AMI and discussing how AMI Expeditionary Healthcare fits into the long-term care space in Pennsylvania. So AMI Healthcare is a healthcare support company, and the company is based in Reston, Virginia. And as a healthcare support company, AMI functions in several key areas. One area is crisis response. So AMI assists in the crisis response role by providing staffing solutions and deploying skilled professionals during critical incidents. Another key area is workforce solutions, and AMI is able to leverage healthcare sector staffing solutions. We also are able to staff and operate commercial clinics, including global hospitals and clinic solutions. And AMI currently operates clinics in Liberia, Sierra Leone, Libya, and South Sudan. And finally, another key area is public health. So AMI works in the public health space by providing testing and vaccination expertise and supporting long-term healthcare quality improvement projects like outbreak response activities and emergency preparedness programs. So circling back to Pennsylvania. So historically, AMI was tasked by the Pennsylvania Department of Health to assist the Commonwealth during the COVID-19 pandemic by providing COVID-19 testing support and COVID-19 vaccine administration. AMI was able to quickly mobilize and deploy testing teams and vaccination teams throughout the state during a time of great need. So as you can see on this slide, as AMI was supporting testing and vaccination efforts, Pennsylvania had organized assistance for long-term care facilities by utilizing what were known as RICP teams, which were part of the Regional Response Health Collaborative Program. And this was early on during the COVID-19 pandemic. And then RCAT teams, which were known as Regional Congregate Care Assistance Teams. And then finally, the state moved to the long-term care RISE teams, and RISE is short for Resiliency, Infrastructure Supports, and Empowerment. So together we rise. So focusing more on the Pennsylvania Department of Health Long-Term Care RISE program, AMI is one of 4 grantees of the Pennsylvania Department of Health. And as the LTC RISE program in Pennsylvania, it is grant funded through the Federal Department of Health and Human Services, and more specifically through the Centers for Disease Control and Prevention, Epidemiology and Laboratory Capacity for Infectious Diseases Grant, or ELC. So overall management and oversight is provided to the LTC RISE grantees by the Pennsylvania Department of Health's Long-Term Care Transformation Office, or the LTCTO. So let me pause here and please advance to the next slide. Thank you. So continuing with a little additional background information, AMI is joined by 3 other grantees in Pennsylvania: Lake Erie College of Osteopathic Medicine, or LECOM, Penn State Health, and Penn Medicine in partnership with Temple Health. So throughout the COVID-19 pandemic and extending throughout the LTC RISE grant, the state was divided into 6 geographic regions. And during the LTC RISE grant, AMI has managed 3 of the 6 regions. We have the Southwest region of the state, which includes the greater Pittsburgh metropolitan area. We have the North Central region of Pennsylvania and the Northeast region. So in total, AMI covers 33 of Pennsylvania's 67 counties with respect to the long-term care RISE grant. So as you can see on this map and overlay, AMI is responsible for assisting all types of long-term care communities throughout our 3 geographic regions. And these include skilled nursing facilities, personal care homes, assisted living facilities, and intermediate care facilities. So currently, we continue to actively assist with both outbreak response activities and quality improvement initiatives in approximately 512 long-term care facilities in our 3 regions. And per the LTC RISE grant statement of work, we're required by the long-term care RISE teams are required to meet certain key performance indicators, or KPIs. And this has been during the long-term care RISE 3.0 and 4.0 timeframes. One KPI involves ensuring a predetermined number of long-term care facilities participate in a workforce resiliency and development staff wellness survey. So the AHRQ SOPS NH version 2.0 pilot and the SOPS Nursing Home Survey fit perfectly into our list of quality improvement initiatives. So the SOPS survey, this validated and nationally recognized tool, can be utilized during our long-term care RISE grant and our long-term care facilities in our 3 regions, and truly throughout the state can continue utilizing the SOPS survey after the long-term care RISE grant ends, which will be on the 31st of May of 2026. So the next slide, please. Okay, so administering the survey. So I'll shift to discussion here related to administering the SOPS survey. As our 3 long-term care RISE teams administered the SOPS survey, our teams were able to build engagement and motivate staff to respond. And as you can see outlined on this slide, leadership buy-in was and is essential. Facility leaders promoted completion and often integrated survey completion into staff meetings, and our teams promoted leadership to utilize messaging such as "Your voice drives change." AMI also provided on-site support, so team members in our 3 regions visited facilities to promote participation, and we were able to provide clarity about confidentiality and how data would be used. Our teams also incentivized completion. Coffee and donuts were often appreciated during breaks when completing SOPS surveys. Coffee can be key. We utilized a combination of electronic and paper surveys to reach all staff types. You can see on this slide that weekly progress updates were also sent to each facility. These displayed completion percentages and the number of surveys needed to reach an acceptable threshold. Our teams also encouraged friendly regional competition, and this was often among several facilities on one common campus. And these frequent updates also created accountability and transparency. Next slide, please. So challenges and how they were addressed. So our teams did encounter several challenges during the survey process, and we'll review some of those challenges and how we responded and what strategies we used to overcome the challenges. So marketing the SOPS survey. Our teams needed to find facilities that had the bandwidth and the desire to work on the SOPS survey initiative. Dr. Matthew Chambers was a past leader of the Pennsylvania Department of Health's Long-Term Care Transformation Office. And at AMI, we appreciated that he coined the phrase resiliency through relationships. And our team's solid relationships with facilities in our 3 regions and with facility leaders is often a successful component of our well-utilized quality improvement programming, including the SOPS survey. So another challenge or concern was regarding anonymity, and our teams explained the survey process and safeguards and also provided paper survey options. Facility leadership turnover is often a challenge in long-term care, not just in Pennsylvania, but throughout the country. Our teams were cognizant of leadership turnover, and we were quick to engage with new leaders and revisit messaging when there was a leadership or ownership change. Another challenge can be competing priorities, and so our teams were able to link participation to quality assurance and performance improvement, or QAPI, goals and upcoming initiatives provided throughout the long-term care RISE program. Occasionally, technology access was challenging, and so our teams were able to provide iPads and internet support on site, which was extremely helpful in some facilities. Time constraints are always a challenge, and encouraging SOPS survey completion during breaks or shift changeovers was helpful. Our teams would often try to cover 3 shifts in order to reach personnel throughout the facility. And finally, survey fatigue. Quality improvement programs often require surveys, and our teams were mindful of recent surveys completed throughout the facility, and were able to shift accordingly. So that wraps up my portion of the presentation. I will now turn the slides over to Jamie Thomas. Take it away, Jamie.
All right, thank you, Bill. We'll go to the next slide, please. All right, so now I'll walk us through the results from the SOPS Nursing Home Survey 2.0 pilot. Across the 9 participating skilled nursing facilities, we collected a total of 428 responses, which gave us an overall response rate of 58%, with 8 of the facilities reaching over 50%. So for our first time administration of the updated 2.0 pilot survey, we were very encouraged by those numbers. We also saw strong representation across roles and departments. One of the strengths of the pilot was encouragement from the CNAs and frontline nursing staff, which gave us a true picture of the day-to-day safety culture. All survey collection was completed by November 2024, establishing a solid baseline for future comparison. Next slide, please. Thank you. So this slide highlights the top 5 scoring items and the bottom 5 scoring items for each system. A quick note, these reflect items from the pilot version, so not every item shown here ended up on the finalized version of the survey. However, the patterns were extremely valuable. The top scoring items typically reflected strengths in teamwork and communication within units regarding resident safety, and the lower scoring items pointed to well-known pressure points in long-term care, staffing adequacy, workload, and comfort with reporting concerns. So these insights helped guide our early conversations with leadership about where to focus improvement efforts. Next slide, please. So the pilot facilities also administered the nursing home workplace safety supplemental survey alongside the SOPS 2.0 pilot. This supplemental data set gave us added insight to staff perceptions around physical safety, injury prevention, and psychological safety. The themes were consistent with the core survey results, which really helped reinforce where targeted support and improvement strategies were needed, with the lowest composite measure showing interactions among staff. So the combination of both surveys gave facilities a more complete picture of their safety culture environment. Next slide, please. So once results were finalized, we met individually with each facility to walk through the reports, and we highlighted their top and bottom composite measures and encourage facilities to share those results transparently with frontline teams, not just leadership. This helped build trust and reinforces that staff voices were truly being heard. From there, we used AHRQ's action planning tool with each facility, and together we selected priority areas, developed measurable action steps, and aligned those steps with the educational and coaching support available through AMI Rise long-term care regional teams. So this ensured that survey results immediately translated into a concrete plan for improvement. Next slide, please. So this slide shows how we align the SOPS survey results with our education and improvement initiatives. For example, when facilities had lower scores in communication openness or teamwork, we linked those directly to AHRQ team steps-based training. When staffing or workload concerns were identified, we supported facilities through workflow redesign and staffing discussions. And if psychological safety was an opportunity, we focused on leadership coaching, daily huddle structure, and communication tools. So the goal was to make sure that every data point had a corresponding path for action. Next slide, please. And this is just a continuation slide that shows additional alignment examples. The themes were consistent across facilities, which allowed us to create repeatable pathways while still tailoring improvement plans to each facility's needs. Next slide, please. And so here we specifically map the workplace safety supplemental survey results to improvement initiatives. Items related to staff safety, injury response, and the comfort level in reporting workplace safety concerns were connected to initiatives like communication training, refining incident reporting workflows, and reinforcing safety leadership behaviors. So aligning both surveys allowed facilities to look at safety in a much more comprehensive way. Next slide, please. So the second alignment slide just builds on the same theme, again, using both sets of results together. The core survey and the supplemental helped guide more holistic improvement planning that address both resident safety and workplace safety. Next slide, please. All right, so looking ahead, we're continuing targeting coaching and education with our pilot facilities. The continuing pilot facilities will complete a reassessment using SOPS 2.0 in the first quarter of 2026, and that will give us our first true measurement of change over time. Beyond the pilot, we're expanding this work statewide in our 3 regions. Cohort 1 includes more than 40 facilities that have already completed their surveys with results now in review. And cohorts 2 and 3 will onboard through the remainder of 2025 and early 2026. So our overarching goal is to support 100 nursing homes by May 2026 using a standardized process that combines survey administration, transparent reporting, and structured action planning. These next steps helps ensure that SOPS 2.0 Nursing Home Survey truly drives meaningful and sustainable improvement. So next slide, please. So I'll wrap up with a few key takeaways from our pilot experience with the Nursing Home SOPS 2.0 pilot survey. First, leadership buy-in is absolutely essential, both for achieving strong response rates and for ensuring that facilities actually follow through on the action planning. When leaders champion the process, staff engagement increases significantly. Second, clear confidentiality education matters. So when staff understand how the responses are protected, they feel much more comfortable being honest, and that honesty is what gives us meaningful, actionable data. Third, in-person navigation made a major difference. Having our team on site to support staff, answer questions, and guide the process boosted participation rates across every facility. And finally, survey data only has value when it drives real tangible action. So the SOPS survey is not just a measurement tool, it's a roadmap to us. When facilities use the results to inform targeted improvement strategies, that's when culture truly begins to change. And thank you all. We look forward to continuing this work with our partners across the Commonwealth. And back over to you, Joann.
Wonderful. Well, thank you so much, John, Naomi, Bill, and Jamie, for your very thorough and helpful presentations. Now it's time for the question and answer segment. Next slide, please. So as a reminder, you can ask a question through the Q&A icon. We encourage you to share your name or organization or role when you type your question. And again, if you're using an Apple Mac computer, you may not see the Q&A icon. And if that's the case, you may try logging back into the meeting through the Teams application rather than using Teams through a browser. So let's go ahead and get to the questions. We have a few back pocket questions here. Let me start with one for Naomi. If we switch from the SOPS Nursing Home Survey 1.0 version to the new 2.0 version, can we compare our scores?
Yeah, that is a good question. The short answer is no. Because the surveys are so very different, even if they're the same composite measure, the items that make up that composite measure are pretty different. So you could try to compare scores on the 9 items that did not have any wording changes, but you should not try to directly compare your 1.0 to 2.0 scores because really any increases or decreases in those scores could be due to the revised wording rather than reflecting true change.
Okay. Next question for Naomi. We've found our scores vary by the shift work most often. Is there a way to compare to the nursing home database for those staff that are working the day versus the night shift?
Yes. So as I mentioned, the reports are available on the database pages for AHRQ. And those results, if you click on the appendix, it's not in the main report, but in the appendix, we do show results broken out by shift worked. So days, evening, nights, as well as staff position, work unit, tenure. And then the 1.0 database and the workplace safety will also show results by some facility characteristics like bed size, ownership, region. So yeah, definitely we have that available for you.
Okay. Next couple of questions are for Bill or Jamie or both. First question is from Georgia Reiner. What strategies helped you enroll facilities in your SOPS initiative? Nursing homes, by and large, seem to have survey fatigue, so I'm curious how to get leadership to buy into SOPS. And if you want to unmute, to provide an answer, that'd be great.
Sure, great question. I think really that resiliency through relationships piece. I think it was based on the fact that we had been working with our facilities for several years. They knew who we were. They knew our role was to really help facilities. So, working with these folks and ensuring that it didn't take a lot of their time. And I think, like Jamie referenced, leadership buy-in. If you had a leader that could see the value in such a survey and then worked with you during the process and with the staff during the process, really helped achieve that buy-in.
Jamie, anything else to add?
No, nothing to add to that. I think that was definitely the relationships that we've built from 2022 really helped us talk to the leadership, and that leadership buy-in is definitely a thing that you need to complete and get high response rates.
And in your slides, you did say that you timed the survey around other survey initiatives? Can you say a little bit more about that?
So we were mindful that, our quality improvement work often included needs assessment surveys at the beginning of a particular time frame of the RISE grant. So if we could see that we had done too many similar type activities, we had different cohorts, especially during this RISE 4.0 timeframe. So if we had done a survey, say in the summertime of 2025, we may be surveying facilities with the AHRQ SOPS survey in January of 2026. So a little bit of time between sometimes was a key factor.
Yeah. And I know, at least for some other SOPS surveys, sometimes the opposite is true, that if there's like an employee engagement survey, that they like to just get them all over with at the same time. So I guess it sort of depends on your facility, how many surveys you're fielding at the same time, and maybe grouping them could also work as well. Thanks for that. The next question is for AMI from Shirley Gerard from SUNY Downstate. Have you given thought to aligning to age-friendly care 4 M's, integration into orientation and annual mandatories?
I can cover this one. So the IHI 4Ms framework is one of our initiatives that we offer to have long-term care facilities be recognized as level 1 and level 2. So one of the slides, I believe, did have age-friendly health systems that we do recommend to go through the process from the SOPS. I believe it is educational or organizational learning that we linked that with.
Great. A couple more questions for AMI. And this is similar to a little bit to the other question, trying to get good response rates on our surveys is always a challenge. Can you tell us what methods you use to get the 50% response rates that you were able to obtain in nursing homes?
So we can outreach facilities virtually or in person. We find that in-person outreach provides way higher success rate, no matter the facility type or size. And then our teams were able to cover multiple shifts. And occasionally we would provide that on-site work in different timeframes. Like, we would be in a facility one week. We would have those weekly progress reports and see that we had hit maybe a 30% response rate, and we knew the number that we needed to meet to try to hit 40 or 50%. So we would schedule a second event. And just working with those leaders that, were really bought into the process, and then in turn covering multiple shifts and reaching as many staff as possible helped us achieve pretty good rates.
So it sounds like a little bit of persistence and continuing feedback to encouragement to get to that rate.
Definitely.
I would like to add with the leadership buy-in again. When we talk about leadership buy-in, it's not just the executive leadership, department heads. Equally important is the role of shift leaders and supervisors who reinforce the message during daily operations, huddles, and shift changes. So their encouragement allowing time to complete the survey really helps the completion rate.
Yeah, that's probably a great suggestion, to be really explicit about, well, when am I supposed to take it on my own time? Or yeah, so providing that time is good. And then I think one final question for AMI. Do you all support nursing homes outside of Pennsylvania?
Currently, with respect to the Pennsylvania Department of Health's Long-Term Care RISE grant, we are solely working in Pennsylvania, but we always have our eye here at AMI and within our team in Pennsylvania, towards other opportunities that are available. So currently just in Pennsylvania, and as I mentioned before, that's through May of 2026, but always an eye on the future and other opportunities that could present.
Okay, great. Well, hopefully we'll be able to continue the good work. Next question is for Naomi. When will the next SOPS nursing home database submission occur?
Sure. AHRQ opens data submission every other year for all active SOPS databases. So, excuse me, the next database submission period will be, or is expected to be, in September of 2026. And we will be accepting both 1.0 and 2.0 versions of the nursing home survey. So make sure to sign up for email updates to get the latest information. And Joann, I think you'll share that at the end of this webcast of how to get email updates. And then we'll be able to announce, when that submission will be.
Yeah, and it looks like Cecilia just put up the slide. So if you wanted to sign up for email updates, you go to the AHRQ website at https://www.ahrq.gov. And then right there in the top right, you'll see email updates, and you can select surveys on patient safety culture or just the nursing home survey. Next question is for Naomi. It looks like one item from the Nursing Home 1.0 survey that a nursing home was using for action planning is not on the new shorter 2.0 survey. Can we add this item back in to our survey?
Yes, if this is an item that you want to track, or for some reason you want to add it back on, you are free to add that item back on. In fact, you're free to add any additional items on. The one rule, if you want to submit to the database and for validity and reliability purposes, we ask that you put that item at the end of the survey right before the background questions.
Okay, great. And along those lines, Naomi, if a nursing home wants to administer the nursing home workplace safety supplemental items, but they don't want to add all of the items to the survey, can they do that? Just take a few of the items?
This is sort of new off the presses, so I'm glad you asked that. When you're submitting to the database, you have to submit all the core, like for the core surveys, you have to administer all the items. But for the supplemental items, you can administer a subset of those. So there is a little rule here, a caveat, that if you're going to administer an item from a composite measure, you should administer all the items from that composite measure. So as long as you're administering at least one composite measure or one single item measure from that supplemental items, that's fine. And you can submit to the database with just that data.
Okay. And they would just add those workplace safety items to the end, just like they would add custom questions or whatever.
Yep, right before the background questions.
Okay, great. Another question for Naomi. Is any certification required to administer the survey?
No, AHRQ does not require any certification to administer the survey. And we do provide resources, though, and free technical assistance. And that survey user's guide is really helpful on sort of best practices on how to administer the survey.
Okay, great. And then looks like this might be a question from an international user. Is it possible to, administer the survey in international settings?
Yes. In fact, there are SOPS surveys that have already been translated to other languages and been widely used internationally. So if you go to the AHRQ SOPS page, you can see some international tab. And we also provide information on how to translate the surveys and adapt it to your setting appropriately.
Okay, great. Well, I'm looking and I don't see any more questions, and we're just about out of time. So as a reminder, the slides can be obtained from the website that we posted earlier, and the recording and the slides will be available after the webcast. And so after the webcast ends, you'll receive an email containing a brief webcast evaluation. And we encourage you to please take a moment to provide us with your feedback, as it helps us improve our future offerings. So again, thank you so much for our speakers today. Thanks for joining us. And this concludes today's presentation. Have a good day.